Hello everyone. Recently we have heard a lot about kiosks from news channels. So what is a kiosk and what is its role in COVID-19 mass screening? Good morning everyone. This is Daily Knowledge for All. Today we are going to talk about kiosks and COVID-19 sample collection aid. We all have seen kiosks, though we may not have called it one. So what is a kiosk? It is a small enclosed structure, often freestanding, open on one side or with a window, selling newspapers, refreshments, tickets, etc. A small retail store in a residential area that carries limited selection of items such as staples, junk food, drugstore items is also called a kiosk. Historically, a small garden pavilion open on some or all sides was called a kiosk. Today, we often see interactive kiosks at malls, airports. These are computer terminals featuring specialized hardware and software that provide access to information and applications for communications, commerce, entertainment, education, etc. So, how could a kiosk help in COVID-19 sample collection? Well, a team of doctors at Govt.Medical College Kalamassery, Ernakulam district, people's representatives, health officials in Kerala, India developed a walk-in kiosk for mass collection of samples for coronavirus testing. They emulated this kiosk within a week of South Korea developing the same to collect swab samples without human intervention. It is a simple mobile cubicle with a sealed glass front and have extended gloves attached at the front, through which a medical practitioner standing in the cubicle can collect samples. It consists of magnetic doors, UV lights, and an exhaust fan, and the environment is very much sterile. The oral or nasal swab can be collected without direct exposure and contact. The idea behind the kiosk is to safely collect samples of patients suspected of the virus in the absence of enough PPE kits. There are also a lot of other advantages. One being the sample collection takes just 2 minutes. The other is that the unit is mobile. It can be transported to other areas if needed. After collecting the sample, the container will be handed back to the person, who in turn will hand it over to another staff. After swab collection, the gloves can be sanitized from outside. This type of kiosk is called WISK, Walk-in Simple Kiosk. 2 such sample collection cabins were installed at Govt.Medical College in Ernakulam on 6th April 2020. A hospital in Jharkhand also had set up the same. The Defense Research and Development Laboratory (DRDL) in Hyderabad has also come up with COVID sample collection kiosk called Govt, and similar kiosks are now being set up in Tirupur, Mysore, Bangalore, and the design has also been given to North Indian states. These facilities have been developed as a preparatory step for community testing, the only effective method at present to contain the virus. A large number of people have to be tested to tackle the disease, so as to allow the immediate quarantine of those infected and also allow lockdown to be gradually released.